Hello, everybody. It's 10 a.m. in Poland. That's why we start the second day of our training. And I would like you to thank you kindly for the yesterday, but I think that today we have also quite interesting topics to discuss. Today's presentations will be divided in two parts as yesterday. Yesterday we were talking about nutraceuticals and cosmetics briefly. And today I would like to describe a little bit more veterinary prescription diets, which are offered under VetExpert umbrella brand. And also in the second part, after a short break, we will be talking about the maintenance pet food, RAW PALEO we have in our offer. Of course, I would like you to ask for the feedback, and Richard is also writing an emails about it. This is quite important for us before we start the second part of the whole program. I mean, before we start the lectures about the specific subjects. I would only like to remind to you that the first such a lecture will be on next Monday, 26th of October. And right now I would like to start the presentation about the veterinary prescription diets. This is the second line of our products, which is growing in the significance in our business. However, as in the case of the pet food, it takes a little bit longer time. First of all, before we start to talk about the specific products, I would like to tell a few words about the legislation related with the presence of the veterinary prescription diet on the market. It's a little bit different in different countries because, for example, in Poland, we have on the one side the European Union directive, which is describing the composition of the animal feeding stuffs for so-called particular nutritional purposes. But on the other hand, many countries have their own so-called feed law or feed regulation, and they are also selling some products on their market according to this feed law. But from my perspective and my point of view, this legislation is this European Commission directive, especially on the area of the European Union, is extremely important because it in fact gives us two types of the information. First of all, is listening. Is giving the clear list of the intended uses. So what does it mean? It means that according to the appendix to this directive, we can easily list the indications for the diets, for the nutritional products, because not all these intended uses must be related with the complete and balanced diet. These intended uses are also sometimes related to some, we call them dietary supplements, or related to the complementary pet food. And the second thing, which is much more important in my opinion, but and must be pointed out, is in fact, this particular nutritional purposes is the list of the features for each of these intended uses, and the features of the pet food, of the nutritional product, which are necessary to be fulfilled by the manufacturers which want to sell any specific veterinary prescription diet or supplementary pet food. This is quite important because it helps us to avoid the significant composition between the products from the different manufacturers. But of course, you have to remember that this directives gives us the information about the so-called intended uses, but is not this is not the law which is regulating, for example, the use of the specific names, just like, for example, mobility or renal or something. So it's up to all the companies which names and what will be the system for the characterization, and will be the system of the names for the specific product. So we can say that we are also working on the market. With the case of the prescription diet, we are working on the market which is legally regulated. We have clear indications for the product. We have clear indications of the lists of this product. So let's go through through our products to see how we decided to fulfill the requirements of this European Union and the Commission directive. So in our portfolio, we have both diets for dogs and cats. We have both dry and wet diets. That's why the list is growing and growing. We also, as all the times, are working on this product. So we are changing sometimes composition, sometimes we are changing the indications. We are trying to introduce new products. Sometimes we withdraw the products which are not very successful. So, in other words, this is quite actively modified portfolio, and sometimes the changes could be easily visible during, for example, 1 year. So you see the list of the product for the dogs is a little bit longer, for the cats a little bit shorter. So let's start from the veterinary prescription diets for dogs. They are right now sold under the general brand name of VetExpert, because many people we are working with and the veterinarians from the very beginning were talking that this is the VetExpert diet. So okay, we says okay, let's put the name or this name on the labels. We will start from the VetExpert Dog Mobility Diet. This is the dry diet, as you see. And what is important for us is that the declaration which is taken from and the declarational claim which is taken from this directive of the European Commission is to support joint metabolism in case of the osteoarthritis. So, in other words, the clear recommendation for this diet, the claim which you can use on the label is like that. So, support of joint metabolism in case of osteoarthritis. What are the requirements? So, the requirements, in fact, are quite clear. And then there is only 3 points on this list of the requirements. First of all is the regulation requires from us the level of the unsaturated fatty acid content. It is 3.5%. The content of the eicosapentaenoic acid, this is one of the omega-3 unsaturated fatty acids, must be at least 3,300 milligrams per kilo. And on the label of the product, the declaration about the content of the vitamin must be included. So how we fulfill these requirements? First of all, the total level of the unsaturated fatty acid is 4.3%, so slightly above the requirement. The total content of EPA and DHA, so both polyunsaturated omega-3 fatty acids. These two fatty acids are considered to exert some anti-inflammatory action. So we have roughly 5,995 milligrams per kilo, and the content of the vitamin E is 654 milligrams per kilogram. So we believe these requirements are fulfilled. As you see on the list here, there is nothing about the molecules on the requirements from the European Commission. There is nothing about the amount of the glucosamine, chondroitin, any other chondroprotectives, nothing like that. The only requirement, in fact, is related with the content of the omega-3 unsaturated fatty acid. This declaration was developed based on the clinical study conducted several years ago by Hillspread Nutrition. They conducted a lot of clinical study. They submitted the declaration, meant such an amount of the omegas in unsaturated omega-3 fatty acid, in fact, are really helpful for the joints and helps to reduce the dose of the non-steroidal anti-inflammatory drug given to the dogs with the osteoarthritis by 25%. In other words, what we obtain thanks to this declaration and thanks to this composition, the content of this ingredient, we reduce the level of the inflammation, and we can say that this level of the dosage of the necessary anti-inflammatory drugs could be reduced by 25%, one-fourth. So that is why this composition helps us to assure the owners, the clients, that this composition has anti-inflammatory action. But of course, European directive does not prevent the manufacturers from adding any other ingredients which could be helpful, and this is what we did. We also decided to add to this mobility product composition of glucosamine and chondroitin. As you see, this is 1 gram per kilo of the feed. We also decided to add avocado and soybean unsaponificables. This is the only veterinary prescription diet in the world which contains this ingredient. We were talking about the cereal. This is also the anti-inflammatory molecule with quite good clinical action. And we also added small amount of the L-carnitine. Here we believe that the problem with the osteoarthritis is sometimes related also with the overweight or the obesity in the animals. That is why we support the burning of the fat in order to prevent the animal from gaining the body weight. But what is quite important, what I have to point out, is that L-carnitine is helpful for the supporting the fat burning and for the reduction of fat level in the body only when the skeletal muscle are working. In other words, if you would like to see the reduction of the body fat after administration of L-carnitine, the patient must be mobile, must be physically active. That is why however, this is not the most important ingredient. L-carnitine is only a kind of supportive one. But thanks to that, I can say that for the mobility, we have few important features. First of all, we can claim two mechanisms of anti-inflammatory action. One is omega-3 fatty acids, which is resulting directly from the European Union requirement. And second mechanism and second type of the ingredients, anti-inflammatory ingredients used are avocado and soybean unsaponificables. Of course, we can say that from the nutritional point of view, we have the food which is quite high in protein, low in carbohydrates. This is also helping us in a small manner to manage the body weight and to avoid the body weight increase, to avoid overweight. And of course, if you are looking through the label, you can see that this pet food also contains fructooligosaccharides, malnano-oligosaccharides. It contains Eucashidigira. So we can also say that these molecules are supporting the gastrointestinal function, the function of the alimentary tract. But of course, this is not the main recommendation for this diet, because the main recommendation is, of course, osteoarthritis. What is also quite important is that to talk few words about the positioning of the diet versus supplements. We were talking yesterday about the three different supplements. I mean, Arthrovet Complex, Arthrovet Collagen, and today we are talking about the mobility. And the question is, what is the difference? Whether we should replace, whether we could replace, and so on and so on. So. What is from my perspective, the supplement cannot supply 3.5% of the omega-3 fatty acids of the daily requirement or daily dose of the food. Of course, we can try to use some, let's say, oils like direct fish oil in a liquid form or something like that, just to put it on top of the pet food or something like that. But normal supplements cannot deliver such amounts of this omega-3 fatty acids. But for sure, the diet is only one of the few methods and one of the few tools we have in hand to fight with the osteoarthritis, because we can use non-steroidal anti-inflammatory drugs. We can use for that some supplements. We can use, like here, veterinary prescription diets. So we always call it so-called multimodal approach. This is the name, the definition which was described in US, I think, 15 years ago. And this multimodal approach, in fact, relies on the idea that we have different tools with different mechanisms, and during the process of the disease, we have to select the proper products and try to mix them together in order to achieve better results. Another product, starting from the very important line of the, let's say, hypoallergenic dermatological atopic products. We start from the line which is called dermatosis. And why is so important? Based on the data we have from the veterinary, from the clinic of the Faculty of Veterinary Medicine at the University of Munich in Germany, we know that based on the data from year 2018 probably, we can clearly say that the number of the allergic patients is the highest number of the patients visiting every day, on everyday basis, visiting the clinics at the faculty. So, and my personal also opinion is that this number will be growing, because all this different aspects of this allergy, atopic dermatitis, and other allergies and intolerances, the number of these patients will be growing and growing. But we have to remember also that the diets which are specifically developed for the allergies and for the intolerances, which are based on the single source of the protein, in the majority of the situation also fulfill the requirements of the diets supporting skin and coat function. That is why for the dermatosis we can use based on the, of course, the list of the intended uses of the diets. We can use two declarations, two claims, and the first of them is the support of skin function in case of dermatosis and excessive loss of hair. So this is clear, I can say, dermatological. So for the dermatological product, we need to fulfill, in fact, only one requirement. This is a high level of essential fatty acids. So, in fact, in this diet, dermatosis.salmon, the content of this essential fatty acids, essential means also unsaturated, is 4.3, so as high as in case of the mobility. So it means that also mobility fulfills the requirement of this skin and coat diet. But generally, dermatosis is the best solution. And this is also why the dermatosis name is used. But going further, this diet was intended, first of all, to use the claim reduction of the ingredient and nutrient intolerances. As you see, there is no word allergy, because such a declaration simply doesn't exist in the European Commission directive, because we cannot say clearly that there are some ingredients which are completely not inducing allergy to all the dog population in the world. This is in many situations individual case. So that is why we are only dealing with the word intolerance, and the best case intolerance, food intolerance we can see in our animals is the lactose intolerance after milk ingestion by dogs or cats, which sometimes arises. But going back to this claim of this reduced ingredient and nutrient intolerance, and of course, we understand it also as a hypoallergenic product. The regulation is very simple. The requirements are very simple. It should be selected protein source and selected carbohydrate source. What does it mean? It means that we need to know exactly what kind of protein is inside the product, especially products of animal origin, and we need to know exactly what type of the carbohydrate are also within the product. The general idea is, in this case, we can say that in case, of course, of the dermatosis diet, we can sometimes call this diet also as an elimination diet. Why? Because we have here a single source of animal protein. In this case, this is the salmon. We have selected or sometimes single source of carbohydrates. In the majority of our dermatosis, this is potato, sometimes also and rice, as in case of the salmon. So this diet could be completely used as a so-called also elimination diet. So the diet which eliminates the whole list of the ingredients in order to put the diet with clearly indicated components. We have two typical dermatosis diets. First one is the salmon. It means that the single source of the animal protein is salmon, and the sources of the carbohydrates are potatoes and rice. On the other words, we can say that the diet is grain-free or typically or gluten-free. This is also helping us here significantly, because it helps us to avoid any gluten protein from the grains. So, this dermatosis is not only the single source of animal protein. We also added some prebiotics, which are able, so fructooligosaccharides, and we added ginger as a herbal ingredient, which is helping us to influence the motility of the alimentary tract. and exert some soothing properties. The same ingredient was previously used, for example, by hills. Uh, but this is not the whole our portfolio, the salmon, because the second product, also quite important, is the dermatosis dog rabbit. Here the composition is a little bit different because the protein source, of course, as the name says, is a rabbit, but the carbohydrate we also only have potatoes. So even we also eliminated rice. That's why this is the typical diet which we can call rabbit and potatoes. And this kind of products are quite similar to the products, for example, of the Hills company, which are diets called DD, where there is two main compositions, ingredients. One is a source of animal protein, the second one is source of carbohydrates. So we have here rabbit and potatoes. And also, quite high important amount of the omega-3 fatty acid. This is the number, of course, from the salmon, because you have to remember that naturally salmon contains a lot of omegas. That is why it is naturally high content. In case of the rabbit, this amount of the omega-3 fatty acid is not so high and reaches around 2%. So also, as I said, this is the elimination product, 1 nanofructooligosaccharides, gingers, but generally the most important thing is the composition and the source of the main ingredients, these macronutrients. I mean, single source of animal protein, single source of carbohydrate. This is not the hydrolyzed protein, to be clear, but thanks to that, because this is not a hydrolyzed protein, we can assure the quite high palatability of this product because we avoid the risk of the bitterness of the pet food, which contains the hydrolyzed protein. And the third dry product for the line of the hypoallergenic products, but with a little bit different name, which is clearly hypoallergenic, not dermatosis, but hypoallergenic. And we simply decided that because of the composition and the source of the, let's say, animal protein, we can be sure to use the name hypoallergenic. Why? Because the single source of animal protein is the insect protein. So this is the completely new approach to the nutritional product in which the protein of animal origin is replaced from the animal meat, animal protein to the insect meal, and in this case, the source of this is the insect Hermetias inlucens, which is in other words called black soldier fly. Of course, the source of carbohydrates is the potatoes. This product is so important for us. First of all, it was one of the very first prescription diets based on insect protein. We were, I believe, first in Poland and one of the first two companies in Europe which started to sell this veterinary diet based on insect. It was for us, I believe, 4 or 5 years ago, and we succeeded. In fact, however, the problem is still related to the some restricted access to the higher amounts of the insect protein for the manufacturing. So we sometimes, unfortunately, have gaps in delivery, but this is not related with our problems from our side. We simply have and generally the market has the problem with the access to the proper amounts of this insect protein because the requirement for this insect meal is growing extremely fast. As I said, the diet has single source of carbohydrate, and this is potato, so we can clearly say that we have grain-free. As a digest, to improve palatability, we use also hydrolyzed proteins, so there is no risk of any allergy. And also we have increased amount of the omega-3 fatty acid, both from the fish oil and from the flaxseed. Why we decided to have this Hermetia illucens? First of all, what is quite important, Hermetia was the first commercially grown insect, and right now these insect farms are growing and developed in many different countries all over the world. So this is a huge interest from the market side. Then we have the huge, this is quite important source of the protein, because the insects, as you know, are invertebrates, so there is no described allergy of any mammals to the insects. That is why we believe this is quite, I can say, sure source of the protein, because its administration could help us in reduction of use of other animal proteins. And this insect meal is also quite interesting due to the very specific composition of the fat, because the insect meal is not only, you see, not only 42% of the protein, but also 35% of the fat. And here we have the lauric acid, which is the very specific fatty acid with the antibacterial, antiviral, and antifungal action. So it is previously the only source of this lauric acid for the humans. For the animals was coconut oil. So right now we have the alternative source of that, and that's why we can say that it is very good and healthy solution. And this is, you see, the life cycle of the black soldier fly. 5 to 8 days. The 5 days is the lifespan of the fly. It producing during this period from 500 to 1,200 eggs. These eggs hatch around after roughly 100 hours, so 4 days, and this is the moment they must be harvested in order to not to transform into the adult form, because the adult form of this fly, as all flies, contains a lot of chitin, and this chitin is not digested, not digestible at all, and reduces the palatability, maybe not palatability, and digestibility of the products. So this is the benefits we can see. And as a final end of our dermatosis line, we also offer you wet diet, which is dermatosis in can. Of course, this is a single source of animal protein. This is salmon, single source of carbohydrates. This is potato. Of course, when we compare it to the dry diet, the amount of this potato in wet cans is extremely low, just few percent. And however, what is quite important, we have, as I said, a single source of salmon, single source of protein, of carbohydrates, grain-free with high increased amount of the omega-3 fatty acid due to, of course, salmon as the most important ingredient and source of the protein. 2 questions in the meantime, as I see. So before we will move to intestinal, I will try to answer these questions. First question was, can we add to the diet Arthrovet complex capsule in old arthrotic dog? Of course, there is no problems like that. By doing that, we simply increase the amount of the avocado and soybean unsaponificables, and we add glucosamine and chondroitin. So we simply are increasing the dosage, without influencing the balance of the pet food. So in my opinion, quite a good solution in this situation could be also for considering the Arthrovet collagen, because it contains a little bit different ingredient and with the different mechanism of the action. If the target of the veterinarian is to have the widest possible scope of the activity. Could reproduce dermatosis scans with rabbits? Oh, that's a very good question. Whether we could, we can, of course, but there are two aspects of that. First one is price, and the second one, I think, is access to the wet rabbit. Unfortunately, European Union are a little bit restricted rabbit breeding in Europe. Majority of the wet rabbit right now comes from the countries, third countries, so-called, from the countries outside the Europe, and not all these breeders of the rabbits can fulfill European requirements. That's why the access to the wet rabbit, not rabbit meal, but wet rabbit is restricted, and there's still a lot of problems with access to direct access to the raw material. Okay. Does the dry food production technology keep additives? For example, vitamins, oil, prebiotics effective? Of course, this is the matter of the discussion for all the time, but it depends on, from my understanding, knowledge of the technology, it all depends when these ingredients are used, whether they are given directly to the kibble or they are sprayed on the kibble after the extrusion technology. Why this is important? Because extrusion technology is high temperature, high pressure, and the spraying of the digest and the other ingredients are occurring without any high pressure and with the temperature around 50-60 degrees, so much lower. That is why, for example, in RAW PALEO diet, which I will be talking in the second part, we are using Enterococcus faecium bacteria, but this bacteria is not given directly to the extruder, but we are spraying to avoid this destruction. Some molecules are destroyed during the process, but to tell you the truth, the destruction of the molecules during the technology is more important in case of the wet food than in case of the dry food. Because in dry food, we have a lot of study, a lot of data that the most important problem with the activity of the active ingredients, especially vitamins, minerals, this activity is directly related to the length of the storage. So the longer the product is on the shelf in the warehouse, the lower is activity and content of some ingredients. And this is the basic feature of the extruded dry pet food. So the length of the storage. And of course, on the other hand, we know that in case of the wet food, in case of the can, this is the moment when the problem is the highest. So it's the stability of these active molecules during technology, during process. After, when the product is already canned and can is closed, then the level of these ingredients is rather stable. So that is why all these calculations for the ingredients are prepared for them before production, are prepared in this way in order to keep the proper level of the ingredients when we are talking about the dry food at the end of the storage period. You can see also on some pet food coming from United States that they do not give the name, the expiry time or expiry date on the label. They only give the information that we guarantee the vitamin level to the date given on the package. So they do not say that the product has expiry date, 2 years expiry period, and then it's not allowed to be used. That only claim that they are able to keep the proper level of these vitamins for example, 18 months of the storage, and afterwards you can give it to the animal, but we are not able to assure the proper level of the active molecules. That's the difference. Okay, let's go further, and we are talking right now the intestinal. As you see, the package of the intestinal is a little bit different because this is the one of the last two old packages of our diets, also with this 40 veterinary diet logo, not VetExpert, but this is how we were changing, and a few years ago we decided to change a little bit the design of our packaging. So this still old package, but it will be changed in this year. What is the indication for this intestinal product? This is the in fact main two indications. First one is compensation for maldigestion. So all the problem of the digestion. So the requirement from the declaration is simple: highly digestible ingredients and low level of fat. That is why we did the digestibility study at the Faculty of the Veterinary Medicine in Wrocław in Poland. We have this data as a data on file. If you would like, because we cannot claim any clear numbers of the digestibility on the labels due to some legal regulations. That is why you can obtain this copy of this digestibility study, and we are sure that it's okay. And low level fat, so this is the fat content not more than 10%, because it is commonly accepted that the complete and balanced pet food should not contain more than 10% if we would like to use this diet also for the patients with the pancreatic problems. So of course this is not a low fat product just like 6% or 7%, but generally this is roughly between 9.5 and 10. Second indication, second claim is because this one is related with digestion, and second one is related with the reduction of acute intestinal absorptive disorder. So this is so we had problem. This is the diet for the patients who have the problems with digestion or with absorption after proper digestion. And here we only need to know that we have increased level of the electrocytes and highly digestible ingredients. And on the other hand, how we fulfill this requirement, we know what is digestibility, so this is the same requirement, and we also give the content of sodium and potassium on the labels, and this content is few times higher, 3 or 4 times higher than minimum requirements, so we know that it is a little bit increased for sure. So this was the requirement. What we added, we added low fiber content, which increases digestibility. So this is for us important because this should be something like not exceeding 3%. We have 2.9. Why it is important? Because we need to have high digestibility, small amount of the feces after this diet, and we know that fiber is not digestible. So, and also is a high amount of the fiber reducing in huge amount of the feces produced by the animal. That is why we give small amount, but not as small as in case of the recovery, for example, product. But it's still. We added inulin as a source of fructooligosaccharides. We added ginger. So we know that this is the product. Which is modifying also peristalsis and sus alimentary tract. For us is quite important. What is also what must be also pointed out is that this intestinal diet is one ever of the best diets in the veterinary practice because it contains quite high amount of the protein. So normal regular pet food for the adult dogs contains roughly 22-24% of the protein, whereas intestinal diets always are containing 30%, 31%. this makes the product extremely palatable with low amount of the fat, low amount of the fiber. This is in fact high protein product. That is why it's always extremely palatable for the animals. Of course, when we are talking about the different products and the difference between diets and supplements, in fact, we do not have such a typical supplements. We can give some products, for example, to modify immunity or microflora, just like bioprotect. We can give the product to avoid coprophagia, like coprovet. We can try to use some enzymes, in case of the pancreatic insufficiency or something like that. But typical, there is no such a supplements. So all this, that's the product we have, could be supplementary to this diet. Of course, still, because this is dry food, we also have a can. And this can, as you see, have also our typical normal regular logo with the name. And also the requirements are very simple: high protein, fructo-oligosaccharides, mannano-oligosaccharides, and low amount of the fiber. And this should help us to restore all the gastrointestinal problems in the dog. But 2 years ago, we decided to go a little bit further with the to go a little bit further with the intestinal product, and we decided to develop completely new formulation of the product for the intestinal disorders based on single source of animal protein. We call it intestinal elimination, and this is in fact intestinal diet, but intestinal diet made from one single source of animal protein, which is also grain-free, as you see, and which is also with quite low amount of the fat. So what is kind of diet this is? This is the diet which is combining the two different features of the two different products. One is intestinal, so we have high level, low fat, low fiber. We have fructo-mannano-oligosaccharides inside and ginger. And also we have the features of the hypoallergenic or elimination diet, which is single source of animal protein, and this is based on the turkey, no gluten at all because this is grain-free, and the rice and potato as the source of carbohydrates. Why it was so important for us? It was quite important because sometimes when we have the allergic dog, we can see clearly clinical signs from the alimentary tract. We can see diarrhea. That is why we have allergic dog with diarrhea, prolonged diarrhea, requiring intestinal diet, but the majority of the diet is based on few different sources of the animal protein, so we cannot use this diet. Yeah? So here we have the solution. On the other hand, sometimes when we have this maldigestion malabsorption syndrome in animals, these patients require very simple diet with extremely short list of the ingredients based on just 2 or 3 of them. And this is also sometimes it's allergic patients, it's intestinal necessary. Sometimes when we have intestinal patients, some features of the elimination or simple diet is unnecessary. That is why we launched this intestinal elimination. It took us a little bit time to enter the market. Right now in Poland, it's the best-selling diet, much better than, for example, regular intestinal. So, of course, we had to convince our clients that this approach is very good. This approach is this two-directional diets are good and good solution for us. And that is why to tell you a few words about the future, we are really focused on this approach in the next future. That's why we are right now working extremely hard on another 2 diets from this elimination, I can say, list. There will be the renal product, so dry renal diet based on the rabbit. So it will be single source of animal protein, it will be rabbit, but the diet will be fulfilling the features of the renal diet. And also there will be another mobility diet based on salmon. So we are hoping that at the beginning of the next year, in maximum in second quarter, we will be ready to launch to another elimination diet, which will be renal elimination and mobility elimination also. So this is the direction we would like to go with the dry food. Okay, I have another few questions. So, does the condition of the warehouse have effects on the production of dry food, such as heat or cold? Though the question is, what are condition influence? First of all, it is the humidity, the most important element which is influencing the storage condition in the warehouse is the humidity inside, because the more humid is the air in the warehouse, the higher problems we have. Normally, it should be no problems depending on the heat related with the heat or cold, unless the moisture is not extremely high, because the most important danger for the dry food is always the moisture, water, not temperature, but water, because once the content of the water in the dry food exceeds 12%, normally it has 9%, maximum 10, but once it exceeds 12%, unfortunately the spoilage of the pet food starts, and we cannot avoid it. We have an extremely high number of the fungi growing and so on. So when we are talking about the storage, in my opinion, the humidity is the most important problem. Then we have rice and turkey are in our region not on the elimination needs. They are very often used in not, but all the time. That is why we will be focused on the diets based on not on rice but on potatoes. But the single source of animal proteins, because it will be not common one single source in all the products, will be changing. It depends on several factors. First of all, accessibility, palatability of the products, and also pricing, because we would like these diets to have also reasonable prices. That is why we will be working on that. I know that we cannot prepare the perfect solution for everyone, but we are doing as much as it is possible. And also Vasilis wrote that some vets have a problem with food containing rice. What was the reason of adding it? The answer is quite simple. This is the balance. This is the balance. You would like to have a complete and balanced pet food. You need to have some ingredients which will be helping you to balance, because you have to remember that rice always contains small amount of protein, which is taken into the consideration, because in the normal reality, when we are talking about single animal protein product generally, you have to always remember that some plant protein is added to this product. Currently, this plant protein is a pea protein, but still also could be the potato protein. In the past, majority of the diets and pet food for the dogs was balanced using maize, using corn and soybean. Right now, soybean is eliminated almost completely. This place is taken by the pea protein. So right now we are balancing the pet food. Even if we have single source of animal proteins, we still have on the list some amounts of the pea or pea protein in order to balance it. So for sure, we will be trying to avoid this rice. We know this claims from the veterinarians that they say, okay, but if you ask veterinarian to prepare the highly digestible homemade diet for the dog, they will be always answering, this is the chicken with rice and carrot. So this is always the problem. But I can understand that some of them says that the rice is not a good solution. Okay, so going further with this elimination diet, I would like only to show you clearly that all the key nutritional factors are typical for the intestinal. So high protein, 30%, 9% fiber free, fructomannan oligosaccharides, and so on, etc. And the huge difference is that we have here no grains, and we have here single source of animal protein. Okay, obesity. This is the one of the toughest diet all the time in the veterinary practice, because the requirements is quite simple: low energy density, but this is not very easy to produce the dry food which is low in energy density, low in energy. Normal regular pet food for dog usually contains 3,400, 3,500 kilocalories per kilogram of the diet. Here, the low energy density should be not more than 3,100. This is the border roughly established. So we fulfill that. But you have to remember that it is not very easy to reduce the density of the product, because on the one side we would like this to have the same volume. On the second side, we need to have a low calories. So what to give? Yeah, what to give? Something which will be digestible, not high energy, but still have a huge volume. This is not very easy. How we obtain this? We obtained it because we added resistant starch. What does it mean, resistant starch? This is the starch which is not digested in the small intestine, and that's why we know that there is starch added to the product, but not all the starch is absorbed, so this is quite important. Second thing is that we have increased protein content. This is also an important element. Why? Because during this development of the obesity, we normally, in order to reduce the caloric content, we increase the fiber. As you see, this is the amount of the fiber, which is 10%. Normal pet food contains around 4 or 5%, intestinal below 3, obesity 10 and more sometimes. But if you are increasing fiber, you are increasing the volume of the feces produced, and you are reducing the amount of the level of the digestion of the protein. Unfortunately, you are not reducing digestibility of the fat nor carbohydrates. That is why they will always use the calories from that. But for the protein, it is important. That is why we increase it. This is also quite similar approach as is used in so-called metabolic diets, because these metabolic diets, they are not based on the fiber, but they contain a lot of protein. But for such a diet, the patients must be completely healthy without any problems with the kidneys, because, for example, metabolic obesity diet for the cat sometimes contains 50% of the protein inside. So you have to have extremely good kidneys. And we also added L-carnitine, much higher than in mobility, because it's 2.5 grams per kilo of the feed. But you have to remember that this patient must be active, and the skeletal muscle must be working properly in order to use this added L-carnitine to burn the fat. We in this product we also have small amounts of the glucosamine and chondroitin, because the majority of the obese animals always have the joint problems. That is why we usually add it. And to support this dry food, we also offer the CAN, which is low in fat, low in energy, has increased dietary fiber and L-carnitine. So these features are very similar to the features of the dry food. And another product, this is the renal product. The recommendation is to support renal function in case of the chronic renal insufficiency. And the regulation is that it should contain low level of the phosphorus and restricted level of the protein, but of high origin. Right now, the legal requirement is that the dry food should not contain more than 0.5% of the phosphorus, and this is what we have inside, because you see phosphorus content 0.5, protein content 70.5. And I have to tell you from the very beginning that these parameters are not the leading on the market, because you can find the diets with 0.3, for example, phosphorus, with the 15% of the protein, because the lowest numbers, the theoretically better action. However, the problem with the renal is the same as with the obesity. It is palatability. And in case of the renal things, there are two factors, nutritional factors, which really influence the palatability of this product. First, it is the protein, because the lower amount of the protein in the product, the lower palatability. In intestinal, 30% reduced always resulted in high palatability. Here we have 15, 16, 17 in renal, and this is a real problem with this, because the palatability is lower. But the second ingredient, which is also influencing the palatability of the dry food in extremely high level, is the salt, and so it means sodium, natrium chloride. And this is the problem, because as you see here, in case of this renal, we decided to decrease significantly the level of the salt and level of the sodium. This is 0.18%, so it is the level extremely close to the ever minimum requirement. Minimum requirement is 0.1. Normal pet food for dogs contain 0.4, 0.5, something like that. So we can say that average pet food for the dogs is a little bit salty. Yeah, because the normal amount is roughly 4 or 5 times higher than minimal, higher than requirement. We decided to reduce the sodium. Why? Because sodium is responsible for the so-called kidney hypertension, and the increased sodium, in fact, increases the pressure of the blood within the kidney. We would like to avoid it. That is why we decided to reduce the sodium, but on the other hand, we still keep the moderately decreased level of the protein, which is still 70%, in order to keep the palatability. And even though this palatability is not still extremely high, we believe that maybe we will be able to achieve better palatability of the renal product with the rabbit, which I mentioned a few minutes ago, and that is why we are waiting for that. Still, we have a lot of L-carnitine, as you see, 2.5 grams, as in case of the obesity. Why here? Because we give small amount of the protein. We don't want this protein to be used for energy. That is why in the meantime, we support the function of the metabolism of the fat, in order to achieve more energy from the fat burning, and not to use the protein for the fat metabolism. So that's why we call, because it's still 17%, that this is a kind of early renal type of the diet. This is highly hypertensive, because of the low sodium content and higher amount of the omega-3 fatty acid. High amount of the free fatty acid reduce the blood hypertension. So this is quite important for us. Another product which a little bit lower amount than the last dry diet, amount of the protein, is the hepatic diet, as you see. This is the product which can be used with the claim support of liver function in case of chronic liver insufficiency. What are the requirements? High quality protein, moderate level of the protein, high level of essential fatty acids, high level of the high digestible carbohydrates. What does it mean? It means that we reduced also, as I said, to the moderate levels the protein, 17.5%. But it's of high protein in the small amount of fresh meat and so on in order to make it extremely palatable. We have essential fatty acids, omegas 3.6, so it's extremely high as for this diet. And we also have more than 50% of the carbohydrates, because the carbohydrates became the most important source of energy in energy for the patients. But what we did, what is quite important in case of the hepatic diets, is also always all the requirements, legal requirements, are also related with the copper amount. We have extremely low amount, so this is only the amount. This is the total amount of the copper which is contained in the ingredients. So we are not adding any copper. We are just leaving the amount which is in the ingredients. So it is extremely low. On the other hand, we increase the zinc. This is the same approach as we have in the Hepatiale Forte Advanced, just to supply the patients with the zinc. This is almost the maximum level, because the upper limit registered in Europe for the zinc is 227 and 27 milligrams. We have 220, so we believe that this is the enough. And what is quite important, what is the single unique feature of this diet, is that we added here phospholipids and artichoke, which are the commonly known ingredient used in the hepatoprotectors. So phospholipids are from soy lecithin, and artichoke is simply extracts from the artichoke. Phospholipids we use in all hepatiale, so this is the ingredient which is extremely useful from our point of view. Artichoke we added also to the ornithil product. So this is for sure the unique composition of the ingredients and features of the pet food. And we also have the diet for that with low copper, high L-carnitine, and with the lower levels of protein. So you can mix this dry and wet diet. And at the end, two diets which are only in the wet form. One is recovery. So here, high protein, low fiber diet. You can easily open the can. You can mix the food with the water. You can give it by syringe. So this is what is necessary, all the features which are simply necessary from the point of view of the recovering patients, which require specific diet to be given. That is why it is in wet form, because it's really hard to imagine that we can produce recovery pet food with the dry form. And the last can, this is something which we launched last year. This is smaller can. This is not 400. This is 200, and this is the can for the mini and medium dogs with the urinary problems, because we can easily see that among the miniature dogs and mini dogs, we can increasing number of the problems with the urinary stones. And this is such a diet. What I would like to point out, first of all, is that we have here not only some ingredients which are acidifying, like DL-methionine, which is the molecule used previously by us only in the product called Urinovet cat dilution, because we know that this DL-methionine is metabolized to sulfuric acid, which has the ability to reduce the pH of the urine. But we also have cranberries, what I would like to point out. Why this is important? Because in dogs, very important element of the urinary tract problems are also urinary tract infections, and these cranberries could be helpful to eliminate the huge amount of the bacteria from the urinary bladder and to reduce the risk of the infections. That is why as I said, this urinary problems with the uroliths, with the urinary, the bladder stones is a kind of, I can say, new problem. Because I used to manage the problem of the uroliths in cats, not in dogs, but still the popularity of these mini dogs is growing extremely fast, and that is why we have the product which is acidifying, so helps to dissolve and reduce the risk of occurring of struvite, and is antibacterial because it contains the cranberry. We have few questions. Client asks about the renal cat food. The renal cat food generally is under the development, but this is related with the whole redevelopment of the diets for the cats. This is not as easy as for the dog because we always have higher requirements for the protein, so the necessity of the use of different combination of the animal protein makes it much more complicated. Can we give recovery with feeding tubes? Of course, but my recommendation is just to mix it with equal amounts of the water in order to facilitate the transfer of the food from the feeding tube. So in some situations, you simply need to make it more liquid. Can recovery be solved in water? Yeah. It could be, but this is not a typical product in powder to be solved directly in water. This is the regular pet food with the specific features. That's why if you would like to obtain the extremely liquid composition, then you can mix it in water and simply to help to push this ingredient through the feeding tube. Our customer often asks for 400 grams, and for dry urinary dog, other implants for the urine. This is the question, because we have no urinary product in our portfolio for many years. This is this small urinary can. I can say small because it's 200. Was the first. If there will be still increasing interest in that, we will for sure think about it. It's much easier to have, of course, 400 grams wet than dry pet food on the market, but we will see. Is there any chance of producing renal dog wet food? Yes, this is something what we are thinking for, and I think that this kind of product is closer than ever. We are evaluating right now 2 formulas, and if they turn out to be quite palatable, we will launch it. However, the biggest problem with the renal is that you need to have in renal reduced protein. So it means that you need to replace the sources of animal origin with, in fact, plants. Yeah? That is why the renal can, is, I can say, not looking for the owner as a product based on the meat, in fact, because majority of the people believe that this is a form of the meat, but in case of the renal, you need to reduce the protein, so you need to reduce the content of the protein and of the meat inside, and that is why it is problematic, because instead of the meat, all people see the carrot inside or something like that, and they start to claim. Recovery in powder, we have the formulation. But you have to remember that such a powder formulation will be based on the egg powder, and once we will be able to find the proper manufacturer for this, we will try to relaunch it, because we had it on the market, but unfortunately the former manufacturer was not able to keep the quality requirements. Okay, this was the part of the questions, and right now we go to the diets for the cats, and this portfolio is much shorter, because in fact we have currently 2 dry diets. First one is the intestinal. What is I only would like to mention is that we have the same claims, so compensation for my digestion and support in the case of the problem with the absorption. The requirements are quite similar, but the huge differences in the fat content, because in dogs it should be not more than 10%, in cats it's around 20%. Why? Because normal intestinal for the cat contains roughly not 30 but 40% of the protein. And with having 40% of the protein, it's simply not possible to keep the protein level on the fat level on the level around 10%, because for such a diet you probably will be forced to use only plant protein. Of course, cats do not like plants. Cats are not plant and herb eaters. That is why it's, if we are able to go with lower than 20% of the fat in the intestinal for the cat, that is okay. As I mentioned, so the same, and the idea is the same with the a little bit different numbers. Also, we have a very low content of the fiber. We added some inulin, but to be honest with you, from the very beginning, we know that the use of the oligosaccharides in the cats, fructooligosaccharides, is not as effective, and generally probiotics, prebiotics, is not as effective as in dogs. This is simply the feature of the typical carnivores and not omnivores like dogs. So that's the point. To support the diet, we also have this can. The can is based on the chicken and turkey. So as you see, two ingredients from the poultry, but thanks to that we have quite high palatability, also fulfilling the requirements just like fructooligosaccharides. Of course, we have some taurine, small amount of the salmon oil. So this is high quality protein product, and as you see, this is the product which can be used for the very wide list of the different recommendations. High protein, high palatability, of course, because of the potatoes, grain-free, and so on. In case of for the intestinal was one of the very first products we were comparing with the competitors in details. That is why I would like to show you right now the example how we compare it, because this is quite important. So this is the comparison. Probably you saw the slides with the intestinal of Royal Canin. So we are comparing, for example, how it looks like. We are comparing composition. You can easily see that even though the energy is the same, we have much more energy from the protein than energy from the carbohydrates, just as in Royal. So this is how it looks like, and the comparison with the hills, and you see this is much more similar, but because the protein is the same, the fat they have slightly high, but in fact we have extremely low amount of the carbohydrates. They have around 6%. Why it is important? Because we are trying to avoid the carbohydrates in cat nutrition as much as possible. So summarization: high protein, low starch, low fiber, and this is how this diet was prepared for the market. Then we have urinary cat. This is the dry pet food for the cats with the stones and with the urolithiasis. Of course, the declaration is very simple, because this is reduction of the struvite recurrence or dissolution of the struvites and so on. But this diet, these recommendations are also were developed during the times when we have separate diets for the struvites and separate diets for the oxalate. Right now, the diet is one, and is one. Why? Because all the urinary diets are required to increase the water intake in cats. Because this is the best approach to the urolithiasis, is simply to force the cat to drink. And if we don't know how to force the cat to drink, especially older cat, we are simply increasing the amount of the salt inside. So you see, we have urine acidifier, which is D-L-methionine. We have moderate level of the magnesium, 0.09. But also the very important ingredient is the salt, 0.7. And this is the moderately increased level of the salt, because we can have high dilution product with more than 1% of the salt. Is this approach effective? Yes, it's effective. We know that increasing the salt could increase the amount of the urine produced even by 25%. But it is effective in the cats with proper kidney function, so without any kidney failure or something like that. We added also glucosamine, but for us, the most important element of this is this increased salt. And what is also extremely important for this diet is the fact that we also offer you the urinary can. Why? Because thanks to that, we deliver the also food in the wet form. Because the problem with the cats with feline lower urinary tract disease is mainly related with the lower intake of the water, not because of the bad composition of the diet, but because the cats are eating only dry food with small amount of the water inside. They drink not enough, and that's why we have the stones. That is why, for us, the urinary diet must be the composition of the feeding the patients with the at least 50-50 dry and wet product, because this wet product is also increasing water intake, is increasing diuresis, and generally wet products always contain water inside. That is why, of course, we have D-L-methionine as in the dry food. We have additionally also cranberries to avoid the risk of the, just like in urine of a cat, to avoid the risk of the infections. But we still believe that the very important thing is the moisture, which is 80%. So after within each can, we have 80 grams of the water, and this could be helpful and help our patients. And other products for the cats are only in the cans. So first of all, this is the can for the obesity and diabetes. Why we can combine it? Because we know that the current recommendations for the nutrition of the cats with obesity, with the diabetes, is just to feed the products with the extremely high protein content. That is why, as you see, meat and meat byproducts are around 2/3 of all the can. And that is why we can use this product with this. We can use this product because we have a lot of protein. If you look at that, that's 11% in the can, but on the dry matter is 55. Normal dry matter of the dry food is for the cat 40, maximum 34, 35. Here we have 55, just like cans, the metabolic cans for the cats. So extremely high amounts. On the other hand, we know that for the diabetes in the cats, there should be no more than 12% of the carbohydrates. And that is why we have the problem here. And we have extremely long amount of the carbohydrates. Zaraz zadzwonię. And sorry, because it was blocked. And right now, that is why we decided to combine these two products, this obesity and this diabetes, because we believe they share the same requirements, so they can share the same product, and it could be quite effective. Then we have, this is the features and benefits with high protein, low fat, low calories, and this is what could be really, really helpful. Okay. Then we have the renal wet food for the cat. This is the product developed according to the recent requirements from the European Union. This contains, as you see, chicken and beef. For us, extremely important thing is that, as you see, phosphorus level is on the quite low level, 0.26 in the ready to give product. These requirements here are also fulfilled, and with the increased amount of the omega-3 fatty acids and reduced amount of the protein, because this obesity had 11%, here we have only 8. So we believe that it will be also quite palatable, and that it will be sufficient to give proper results. Then, when we are talking about the renal, generally for the renal dogs and cats, you know that I was talking yesterday about the renal bed, and as a phosphorus chelator. This chelator could be easily used with all our diets, because you saw that we reduced the level of phosphorus in the diets, but there is still some amounts, so you can still use together renal that together with the renal diet, because the mechanism of the action is a little bit different, and we can achieve the better results when they are simply given together. So during the meal, the capsule of the renal vet could be given. Then we have the hepatic product, which is also monodiet, based on the single source of animal protein. In this case, this is the chicken. And what we have here, first of all, this diet could be given especially for very young and Siamese cats, because they have the tendency to the depositing the copper in the liver. So we would like to reduce this risk. And we have moderately high protein content. We have high content of the unsaturated fatty acids, which are also anti-inflammatory. So we believe that also this diet, which will be fulfilling the requirements of the hepatic cats. And the product, which is labeled as a hypoallergenic, and this is based on the single source of animal protein. It contains the high amount of the turkey, as you see, and it also contains the small amount of spirulina. The spirulina is a new ingredient for us because it comes from the microalgae, and it contains some proteins, some essential fatty acids. So it helps us to balance the protein requirements in this case, in the case of this cats, which require the diet. So if the cat is not allergic to turkey, then it could benefit from this diet very well, because we know that the list of this specific ingredients contained in spirulina could be quite long and could exert quite wide activity. So, to summarize, we have several dry diets for the dogs, as you see. nine dry diets, 6 wet diets. For in case of the cats, right now we have only 2 dry, and we have 6 wet. Yeah, so that's the whole portfolio. I will try also to. Is there any advantage of moving to cans instead of sachets? Okay, so cans always give us the better ability to change the composition when there is not good result from the market, to tell you the truth. We can easily influence the composition because the batches which are produced are smaller, so we can, from a batch to batch, we can change slightly the composition if we need to support them. This is quite interesting. The cans are quite obvious. We are still thinking about the development of the wet food on very specific trays. So it's plastic tray with aluminum cover. Maybe this will be also a solution for the wet product. We will see this market of this trays is developing very fast. So this is also an option for us. Can we use urinary for prolonged periods of time, and it's not for how long? The urinary dry food is developed in this way that it contains this is not a high dilution, yeah, because the recommendations for high dilution pet food is just 3-4 weeks and it's over. The recommendation for this diet is 0.7%, so means that it could be given lifelong without any problem. It slightly stimulates the urine production, but not extremely. It is not diluting highly the urine. And once the dry diet will be combined with the wet food, then the problem disappears. What is your diet recommendation in case of oxalate and cystic stones in cats? So in case of the oxalate, the only solution is simply to remove surgically. But if once it is removed, the increased water intake prevent equally from the development of the oxalate. So because once the struvites are present, then we can dissolve. But when the oxalate is present, we have to reduce it surgically, and then we can give the water diet stimulating water intake, and maybe it will be and it should be okay. The same story is right now. The whole world moved to the diets which stimulate water intake, because the reason of the feline lower urinary tract disease, especially urolithiasis, is simply reduced access to the water. When obesity and renal diet will be available? There is a lack of them in the market. That's the question. We are working, but this is the wider question which we will be deciding with our marketing and export team. I cannot give you right now the single day. Good to read, Lulich, of course. This is this is the good paper because Dr. Lulich is considered to be one of the leading person in the United States working on the urolithiasis in dogs and cats. So these recommendations are very good. However, my opinion is simple. I mean, more water, and the problem will be eliminated. Okay, so that was all what I presented about our diets. Right now we have the time for the break. I mean, just like yesterday, 15 minutes. So we will start roughly 11:45, and we will be talking about our portfolio of maintenance food with the brand under the brand RAW PALEO. So thank you for this part, and I'm waiting for you in 15 minutes. Hello. I hope you are back with a cup of coffee after the break. And right now we will be talking for the rest of the day about the origin of the raw paleo and about the characteristics of these products. But before we will go further, few questions appeared also. What diet would you offer for those who has pancreatitis and renal failure? If we would like to have the commercial product, I would select hepatic from our line. This is because it's the quite lower amount of the protein. I mean, roughly 17%, but it's also low fat and not so high fat, because in this situation we need to have the low protein, low fat diet. But on the other hand, if you require a homemade diet, so you can just prepare the regular boiled rice with small amount of the chicken on top, because rice is a pure source of carbohydrates and energy. So no high protein, no high fat, and chicken or turkey are the source of the meat, which extremely low amount of the fat also. That is why such an approach could be also possible. Another question: what is the substitute diet for congestion heart problem? First of all, if we have congestion heart problem, so we have increased amount of the fluid in the body. So the first approach is always to give the product with to pharmacologically reduce the amount of the fluids in the body. But when we are talking about the diet, I don't believe the regular cardiac diet will be okay, because it's contains low sodium, so it's extremely low palatable, and that's the problem. To tell you the truth, there is no specific diet for the congestive heart failure. However, if the patient suffers from any other diseases or have any other parameters which are not in the proper way, so maybe we can select something. For sure, in such a patient, I would give cardiovet to support the function of the heart muscle, because the cardiovet is quite okay for that. If not, if you require the diet, I would select the diet with the highest as possible content of the L-carnitine, or highest possible content of the taurine, because these are the two ingredients which will be in reality supporting the skeletal, the heart muscle. And the question with the diet for the Cushing disease, here I would like to see the parameters of the animal, whether this is early Cushing, late Cushing, what is the function of the liver, because it's really hard to recommend, because this is mainly endocrinological disorder, and that's why I cannot give you right now the clear recommendation, because it's up to the patient which parameters has already changed and which are still in the normal ranges. Okay, so let's go to the maintenance diets. So to the raw paleo. Generally, raw paleo is a big project for us, because it is related with the development completely new brand of the maintenance pet food, dry food for the dogs. It was the beginning. However, it is right now going further and further. So we have wet food for the cats, wet food for the dogs, and just to close all this portfolio will be dry cat food, and also some snacks. But how we was started to work, I would like to mention just few words, because I would like only just to tell you that we are clearly watching the market, which is changing. We are clearly identifying the trends in the dog nutrition and the changes which are on the market, and some of these new trends has had a real great influence on the way how we was working on this diets, and what we took into the consideration. First of all, because I am academic teacher and researcher, we were looking strongly on the results of the recent studies and recent research in the field of the dog and cat nutrition. That's why we took into the consideration all these nutritional behaviors. They also will took into the consideration that the owners are simply looking for new information, for new science, and that some changes in the technology of the pet food manufacturing, especially dry pet food, which we also took into the consideration. So how this trends influenced the development? First of all, there is a lot of new papers about the nutritional behavior of the dogs. So we took it into the consideration, bearing in mind that the quality of the meat and quality of the protein and is a most important element of the pet food. The oral cavity or quality and health is also quite important. Then we were also looking at what the owners wants from us. We right now know clearly well that the owners are looking for the information also in the internet, not only in the veterinary clinics, because these two sources of the information are the most important for the owners. That's why we have to prepare proper support, and this RAW PALEO event was also related with the development of the digital part of our activity and the presence of RAW PALEO subjects on the Instagram, in the internet, on the Facebook. So it also changed significantly the whole RAW PALEO project, the way we are working right now. And this is the case. What is also quite important, we know that the social media are important from the social point of view, but not very important from the scientific point of view, and are not very important source of professional knowledge. That's why we have to develop it completely separately. What is also quite important, that extremely small amount of the number of the people are completely not interested in the information about the nutrition of their animals. This is also very important information. So it means simply people are looking for a good evidence, for a good data. And also we took into the consideration the information we received from our partners that there is a little bit different technology of the extrusion of the dry pet manufacturing, which was called thermal clean, and which allowed us to give huge amount of the fresh ingredients directly into the produced pet food. This fresh ingredients, fresh meat, changes significantly palatability of the pet food. It changes a little bit also texture of this. So once we are using this technology, a little bit more expensive than the regular one, that we can receive some benefits which were simply not available for us earlier, and that is why we decided to go with this high amount of the fresh meat, because it gives this unique opportunities. We also know that there is extremely huge space for the animals anthropomorphization, and we know that right now the products offered for the dogs and cats must fulfill, first of all, the requirements of their owners, And for the owners, sometimes they have very strange expectations, and sometimes they have different philosophies for the feeding, just like vegan, just like barf. So it changed a lot, and we know perfectly well that complete and balanced pet food is not everything, because the pet owners would like to have in their hand also properly developed treats, snacks, in order to make a whole nutritional program for the healthy nutrition of their dogs and cats. That is why this is not surprising that once when you ask the owners what is the most important factor influencing decision making related with feed choice, the first answer was natural. So even though the people simply not always understand what natural means and what is the nature means, it's still huge amount. They still point out the role of this natural pet food. So we have to be able to explain what this natural pet food means also for us. Also quite important is the quality of the ingredients, type of the protein, high protein level, and so on. So this natural food and the very well known ingredients, this is the basis for the, I believe, successful development of the pet food. So generally, after looking at this, what is happening on the market, we in fact came to the simple conclusion that this new nutritional trend reflects mainly growing knowledge and awareness of the owners, and these new trends are mainly appear in the premium sector. So it means the more expensive pet food gives you more abilities to be present on the market. So based on that, we developed the concept. The concept was that we need to offer the product based on the scientific study, and on the other hand, based on the client expectations. So in other words, should be the product which is a reflection of the natural food ingested by the dogs, that it should be single source of animal proteins due to the risk of potential allergenic problems. This should be the product with the simple composition, with the content of the ingredients which are clearly to understand to everyone, and with the product with huge amount of the fresh ingredients, because they increase the palatability and increase the image of the product. And also thanks to that, we are able to assure the proper palatability of the product. So I don't want to talk too much about the dog eating behavior, but you have to remember that when we are talking about natural pet food, we have to remember that this natural pet food was a natural wolf food in the many years ago. That's why this is nothing surprising that the nutritional habits of the dog clearly depend on the nutritional habits of the wolves. It means that these animals eat extremely fast. There is a high competition and the hierarchy within the group of the animals. That's why there is also a hierarchy with the access to the bowl. This is quite important, especially at homes when we have more than one dog. The dogs like to eat excessive amount of the food, even though sometimes the amount is more is bigger than the possibility of the dogs. So the vomiting is occurring from time to time. We know that the presence of the other dogs could stimulate the finicky eaters to take larger food amounts. We know that the dogs can hide the food for the future, especially in the garden. And we know that the dogs are eating the food mainly during the day. During the night, they are sleeping. This is the difference, for example, with the cats, because cats eat all the time. So the most important question, especially when we are talking about the nutritional habits of the dog and the way the dog eats, is whether the dog can self-limit the food ingestion. This is happening in the cats, especially when the cats are not sterilized or not neutered. And normal cats are self-limiting eaters, so they eat specific amounts of the food every 2-3 hours and so on. For dogs, seems to be not possible, and we even know that sometimes some dogs of the breeds are, in fact, adapted to eat a lot, and the Labradors are the best examples. We know right now, after the studies from the recent years, that Labradors simply have some genetic defect which make them always hungry. That's why they eat a lot all the time, and even after a meal they are really able to take another one. So it means that we know much more, and that's why we can do more to adapt the products we offer to the dog's expectation. So, since we know what are the trends, what are our idea, what should be ideal food, based on that, we developed, in fact, the RAW PALEO, because we believe that we need to have at the beginning one source of animal protein in the product. We started from turkey. Right now we are working on beef. So we believe that the very basic RAW PALEO line will be only line with single source of animal protein products. Then we believe that this is a grain-free approach, that we need to have some functional additives adjusted to the animal age, that we should have fresh ingredients inside. And because we would like to be grain-free, we have to accept that the potatoes or sweet potatoes will be the single source of starch in our diets. Why we selected for the first product turkey? First of all, we selected turkey because turkey meat has very few beneficial features when compared to other meat sources, and they are also different than chicken, and also, but on the other hand, still price effective and cost effective. But we know all that turkey meat is easy digestible. This is extremely good source of the proteins. It is the meat with the low sodium content, so it could be a good solution for the dogs with the kidney failure, and then with any problems with this or with the heart. This contains a lot of selenium, and this could be the ingredient which is really hard to supplement. So that is why once we have high selenium intake with the diet, we can easily manage many problems related with the selenium deficiency, just like problems with the immune system or with the fertility. Turkey meat is a good source of the niacin, vitamin B6. So these two vitamins are involved in the process of the red blood production. So that's why it could be helpful. And also it contains increased level of the tryptophan. We were talking yesterday about the tryptophan when we were talking about the CAMVET. we know that this increased level of the tryptophan has a little bit calming effect on the animal, and it's extremely important during the training of the puppies when this lower protein but higher tryptophan level necessary. Why we decided to have all this product grain free? There is this two arguments for that. First, we would like to be grain free because thanks to that, we can avoid the gluten protein, and this is quite important. This is very important for us because this is potential source of allergens. When we have single source of animal protein, we don't want to be any other source of protein contaminating this this diet. And also grain free means no risk of the mycotoxin intoxication, no risk of the mycotoxicosis, because once we have no grains, we have no potential raw materials which could be contaminated with the fungi. And if we have this fungi, we can assume that they will be producing their metabolites, and these metabolites are simply mycotoxins. So this is the support for the grain-free approach. Why we decided to use some functional ingredients? Of course, we wanted to avoid this, let's say, Chinese soup of the mixture of 20,000 of different ingredients, because everyone is important. However, we really are aware that some ingredients are more important in specific periods of life of the animals than in others. That is why we selected the list of the ingredients we would like to use, but we decide to, let's say, manage them somehow in different products. What is on our list? First of all, this is docosahexaenoic acid. We know that from the previous study, or for example, or even from the Hills company, that it is really support for the brain and vision development. So it is also used in this way in our product. We have prebiotics, so fructooligosaccharides, banana oligosaccharides. You know, they are important for the proper alimentary function and for the immune stimulation. We have the green-lipped muscle extract from Perna canaliculis, which is the ingredient used commonly in the diets for the mobility problems and the problems with the joints. Borage oil is our main ingredient of the Vetoskin, because we know that it works perfectly well for the skin problems. Salmon oil, main source of omega-3 fatty acids, so anti-inflammatory ingredient. And Enterococcus faecium, this is the probiotic bacteria also present in Bioprotect, for example, in Coprovet, because it has a really beneficial influence on the microflora in the alimentary tract of the animal. Glucosamine and chondroitin, chondroprotectants used for the animals with problems with the joints or with the cartilages. How we decided, how we switched it, you see that we decided to start from the 6 products, dry products, puppy for mini breeds, medium breeds, large breeds, and adult product for the mini breeds, medium breeds, and large breeds. There is no product for the senior, and as you see, depending on the category and on the age group, the composition of the functional ingredients could be different. So this is how we decided to do it. And we are claiming a lot of fresh ingredients in our product. And this is not only our, let's say, idea, but this is based on the significant important results of the clinical data. And this paper clearly shows that once we are used the meat inclusion in the manufacturing of the pet food, we know that we can achieve incomparable better palatability, and we can achieve decreased bitter taste of feed. So what does it mean? It means that the higher amount of the fresh meat, which is added instead of the major part of the meals, is in fact resulting in a much better palatability, much lower bitter aftertaste of this product. That is why we selected it. And potatoes and sweet potatoes at the end. This is the consequence of the grain-free approach. This is simple and not requiring any other explanation. Because we would like to be grain-free, because we would like to avoid also rice. That is why the starch is from potatoes and sweet potatoes. You have to remember that the average dog, maintenance dog for the dog, contains roughly between 45 and 60% of the starch, every product. In case of the cats, this is the amount between 22, 25% to 40%. And so the starch is extremely important as element in the process of the pet food manufacturing, and the source of the starch is a key factor influencing its palatability and the texture and the consistency. So we developed the formulas, we launched it on the market. We ordered the product, but before we launched it on the market, we also conducted nutritional studies. This is something exceptional. This is not normally used by the manufacturers, but we decided that we would like to have half a year nutritional study before we will launch. We would want it to be completely sure that it will be a good product on the market. So we ordered the studies at the Faculty of Veterinary Medicine in Wrocław, at the Wrocław University of Life Science. And these studies involved the evaluation of the nutrient in the feed. So as you see, the amount of that was almost as declared. So the process of the manufacturing of these ingredients was okay. We had very good palatability. So we had 6 dogs, and all these dogs ate the food given on everyday basis, no problems, 100% of the acceptance. We evaluated so-called fecal quality. So you see, we were able to evaluate the quality of 96 defecations, and we can claim that we have normal defecations. So the consistency of the feces was completely normal, and the scale we were using is a 5-point scale. In this scale, the normal defecation is between 1.5 to 2.3, and the ideal defecation is between 1.5 to 2.5. So we have all normal, 1/4, almost 1/4 was ideal. The average value of the feces quality was 2.76. Once again, the scale we were using was from 1 to 5, and the best is somewhere in the middle, so around 2.5. So we can say that these results of the feces quality are very good. We checked also digestibility, so we can say that we can have the digestibility of the energy 95%, carbohydrates 90%, crude fiber around 90%, crude protein around 78%, and general all organic matter is 80%, for close to 85%. So very good results, no problems we see here. And so the summarization of the study given by the faculty was that the digestibility of the nutrients in the investigated product was considered as good, whereas digestibility of the energy was considered as very good. So it was satisfactory for us. This is, for example, how we were measuring the palatability. This is the example how we are doing that in the 2-bowl study. So we were checking for this study is conducted for 2 days. First element which is evaluated is the choice of the food, first choice based only on smell. So we were better than our competitor. For the first choice, eat. So this means First choice means which feed will be first smelled. This means which will be first eaten, and this is the preference. The preference, as you see, very good on the first, almost equal between us and as our competitor, almost equal. So we are rather targeting toward this. If we will be able to achieve as good, at least as good result of the food preference as our competitors, we will be, and we are in fact really satisfied with this result. And this is the data from the evaluation of the laboratory analysis in the dogs. This is the data from the day 0, day 180, and you see first two parameters are liver enzymes, so nothing is changing. In fact, the slight increase of the enzymes could be simply a result of the increased metabolism of the protein within the body. Plasma protein, albumins, glucose are still within the ranges, so nothing is happening. And we have also red blood cells, white blood cells numbers normal. So what we can say, nothing harmful happened. Half of the year administration, good results. The product was ready on market. And I can say that based on that, we have very good concept, we have very good formula, we have very good recipe, and we have very good product. And such a product is simply incomparable on all the market. So, as I mentioned, we developed the 6 formulations based on the same, I can say, same ideas. So 3 puppies for the mini breeds, adult breeds, for the mini breeds, medium breeds, and large breeds, and the same for the adults. So we have 6 products and no senior, even though we are still a lot of people are asking. Because for the senior, the requirements for these products are not clear. No one knows what we should rely on, and we don't want to make any specific mistakes by preparing the senior product in the meantime, there is no, as I mentioned, nutritional requirements for the senior dogs. So nothing to you can compare yourself. So, but after one first year, we developed to extend our line for the cans for the dogs, and we believe that in case of the dog, our market, Polish market, is extremely large. We have roughly more than 7 million dogs. So that's why the wet food in cans was a natural consequence of the dry food prepared and offered on the market. We decided also to use some claims used previously for the raw paleo dry food. I mean, to use this monoprotein, to use the declaration related with the content of this monoprotein. For the cans, it was possible to use the icon with the amount roughly 70%, around 70% of the meat per 100% of the whole final product. So as you see, we also have it to have it grain-free with excellent taste, no artificial colorants, and ingredients at the level of human consumption, non human grade. Since, yes, you see, this was monoprotein. However, the cans with smaller minimum order quantities allowed us to start not from 1 taste, but from 3. So it was turkey as a consequence of the turkey dry line, but we also offer beef product and lamb product. So the turkey, we were talking about this meat, but you have to remember that the lamb is generally rich in omega-3 fatty acid. contains conjugated linoleic acid, which is able to support the loss of body weight, and also a huge amount of the niacin, vitamin B12, riboflavin, and zinc and selenium. Beef is meat rich in iron, rich in phosphorus, highly palatable, also with the excessive amount of the some vitamins. So these three sources of a meat became our basis for the development of that, and based on that we have, as you see, such a line. This is a kind of example. What is for us quite important, that every meat type has its color. So the turkey is yellow, the beef is red, and the lamb is kind of violet, something like that. But this is typical coloring. The line for the beef is three products. One is puppy, second one is adult, and the third one is light. However, light, this is only the name, because it could be also given to the older animals. It could be also given to the sterilized animals. So this is a little bit lower in energy and the ingredient content than the adult. So as I said, beef is in red. Lamb, also the same categories: puppy, adult, and light. And the same story is in case of the turkey. However, because we were talking that the turkey is a consequence of the dry pet food line, we are giving clear information that you can replace 1 can of this raw paleo turkey wet food for 110 grams of raw paleo raw paleo dry food for the puppies. In the case of the adult, these values are the same. Why we give this information? Because we would like to facilitate to the owners the mixed feeding, so the owner can, for example, calculate the daily dose of the dry food, and they say, okay, if my dog needs to receive 500 grams of the dry food, I can replace this 110 grams with 1 can. And this mixed feeding is also very good solution, and so I believe quite well accepted. And after launching the wet product for the dogs, we decided also to launch the wet products for the cats. So these products were developed in sachet. And here we have also 3 tastes. So we have beef as in dogs, the turkey as in dogs, but the lamb was replaced with game or wild animals, something like that. So this is how the taste look like. So these 2 colors are the same. This game became green. So we have products for the kittens. As you see, this is kitten turkey, and we have kitten beef and kitten game. This is how it is written, and it's roughly meat and offal is around 70% of the whole sachet. We have also 3 products for the adult cats. So this is also turkey, beef, and lamb and game, as it was. And the third category is sterilized. Here in dogs it was light, but here we have sterilized. This is because we know, and we are perfectly well known, and we are aware that the sterilized category is extremely important for the cats, and that we need to develop these cats. The idea is simply the same as in the whole raw paleo. So If it is raw paleo, single source, monoprotein, single source, so the ingredients, the meat and all the products of this ingredient is roughly 70%. Then we have the turkey broth, which is another 30, and the other things are small amounts of the rice or any other ingredients and the minerals. General idea is, of course, that we are not using any specific functional additives which are excessively required. Of course, if you look at this, for example, composition, you can see that among additives we have taurine, which is normal for the dog, cat, but we have also L-carnitine and we have DL-methionine. So the ingredient which is acidifying urine and the ingredient which is supporting the burning of the fats, what is in case of the sterilized turkey quite important. If you are looking at sterilized beef, you can see also the same mixture at the end. DL-methionine, so acidification of the urine, L-carnitine 200 milligram, and the taurine. And in the case of the sterilized game, you also have the same ingredients as additives, but this is DL-methionine, L-carnitine, and taurine. So this is the same. So as you see, this functional ingredients in these cats products are simply the same as commonly used. Nothing very special, but we believe that this is the ingredients which must be given to the cats. There is no excuse for that because they are simply helping them in the normal functioning. What is quite important is that we started dogs with the dry and cats with the wet. But this is what the real marketing data shows us. Yeah? Market data show us that the market for the dry is bigger in dogs, market for the wet food is bigger in cats. And this is what is going on. The question is from Vasilis about the sterilized, is the gluten-free? It depends, because you see that we have parsnip here, and in case of the in case of the bees, this is the sweet potatoes, and in case of the turkey, this is rice. So for the rice, I cannot clearly tell you that it is gluten-free. It's grain-free for sure, but you can say that, okay, the rice is still a small risk of any traces of the rice protein. For the potatoes, this is a little bit different, and so that's why it's always necessary to look through the exact data. Sometimes it is this different composition when we are talking about the vegetable ingredient is because it is important for the palatability, the meat. And the question related with the game meat from the Andrews, yeah, it's the problem which appeared after we produced the pouches. And unfortunately, we have to use these pouches. The problem is that if you are looking at the game and the logo, maybe will be somewhere. Okay, you can see it here. Yeah, this is the logo. We know that this is the meat from the wild animals. It could be wild boars, it could be deers and something, but generally the animals which are normally functioning in the wild. And the name was game because we believe that this will be the best word describing in one word this wild animals source of the meat. But unfortunately, the logo is strongly suggesting that this is the wild boar. and because the wild boar is very close to swine, of course. So I have heard a lot of people that we cannot claim the pork in our diets. Of course, this is not a clear pork, to be honest with you, and the difference in the sensory features of the pork and of the wild boar is quite different. However, yeah, maybe this is not the best option which was accepted, and probably while doing the new batch of this pouches, the packaging materials, we will be thinking about the change of the logo. However, on the other hand, it's really hard to imagine what would be the best, but still, I still don't know. We will see. Okay, so it seems that that's all for the short overview of the RAW PALEO. As I mentioned, this is prescription maintenance diet, so we are not trying to claim any specific, let's say, pro-health features of this product. This is a regular food for the healthy animals. This is how it works. But for sure, I wanted first to explain to you that it was really the product which was we were thinking a lot about of that. And that is why how we develop, how we are thinking about it. Of all, right now, the natural consequence of the development of this line is dry pet food for the cats, and we believe that will happen somewhere in the middle of the next year. Okay, and another question from Andrews. So the answer should be wild animals meat. Yes, it should be wild animals meat. Yeah, but it was really hard to put this long description on the pouch. But as I said, we will improve it. And I saw one question which I did not answer from the first part. It was a question from Metka about hepatic diet. When you start, if there are only slightly increased enzymes without any clinical picture and normal bile acids, and when you add hepatic advanced without biopsy, can you add both? Okay, so first of all, our experience from selling not only hepatic diet but also hepatiale is that the first sign of the annual hepatic problems is in the majority case of the cases is completely accidental. So the owner is doing the laboratory analysis, and by accident it turns out that the liver enzymes are elevated. Though there is no other clinical signs, so the recommendation of the hepatiale forte, regular hepatiale, is in majority of the cases insufficient to reduce the level of the increased enzymes activity. However, you have to remember that if the dog is fed with barf diet, then the activity of the aminotransferases could be elevated for the much longer period of time. So we normally recommend to move to the if there is no other clinical signs, to move and no other laboratory signs, to move to the hepatiale forte, or we are trying to recommend sometimes hepatic if the owners would like to do it. But normally it's hepatiale forte. When we start to see the problems related with the bile acids, with the, for example, level of the animal protein, or blood urea nitrogen, and something like that, so the problems with the metabolism, where we are for sure are trying to go to the hepatic, because hepatic diet, because hepatic has a decreased level of the protein, so in case of any disorders of the protein metabolism, it could be helpful. However, if we see toxicity, And this was also clearly shown by our internal study. And we have the problems with the bile acids, or we clearly know that there is intoxicosis, and the results, the bad results of the liver are a consequence of the intoxication. Then I believe the administration of hepatiale force advanced is necessary, because among all these ingredients, only S-adenosyl methionine and silimarin exist any activity against this toxic consequences of the liver disorder. So that's all, and this is how we work. Okay, since I can see no more questions, I would like to thank you very much for your patience and the participation. In this event, I would like also to invite you for tomorrow, and will be no me, of course. It will be Natalia, who is our senior product manager for diagnostics, and the person who started to work with us with the diagnostic many years ago. She is right now the happy mother of 2 children, so she came back after maternal leave and will be, I hope, managing this diagnostic part of our company in the future. And she will be talking about for the introduction to diagnostics. So it will be roughly 2 hours, I think. And tomorrow's event will be the end of our monitor searching screening of our portfolio. From the next Monday, we start with very specific subjects regarding the diagnostics and regarding the diagnostics. So we will deliver to you the list of the subjects, topics, and you can participate in these events, in these webinars. It's up to you which subjects seems to be for you more important. And so we would like also once again to ask you to give us feedback, what was good, what was bad, and we will also try to improve ourselves in order to provide you the very good information and very good data about not only our product but also generally about nutrition of dogs and cats and about the diagnostics. Okay, so thank you once again. Thank you very much.